So this is my role play on dealing with emotions at work. The situation we're going to walk through here is Danny is the nurse on the floor and I'm the nurse manager, and we recently switched over to a different documentation software, and there's been a lot of concern on the floor amongst the other nurses, and Danny's coming into my office to express to me.
Hey boss, can I talk to you for a second?
Yeah, come on in, man. Have a seat. I've noticed you seem to be very stressed at work and I'm concerned.
It's funny you mentioned that. That is exactly why I'm here to speak with you.
Hit me with it. What's on your mind?
So as you know, we switched to the new documentation software, and a lot of us on the floor are stressed about how to use it. I know we have had training on it, but there are a lot of growing pains, and more often than not, we do not have the time to properly and accurately fill out the necessary paperwork. I'm concerned for myself and the other nurses, as we do not want to be brought up by QA/QI charges.
Wow, Danny, that is a big concern. I don't want to get in the way of your work, though. You have been doing a phenomenal job and you are a great nurse.
How do you think we should fix this?
I'm going to talk to the tech people here and see what we can do. If it means bringing on another person for the sole purpose of documentation, then so be it.
All right, perfect. Thank you, Lewis. It means a lot knowing we have a great boss like you to lead us.
The job takes place in a nursing department at a long-term care facility. Because the recent outbreak and pandemic of the coronavirus puts elderly at great risk, there must be a change in performance standards of the staff. This is to control and prevent the virus and any other infection from putting the patients and elders living there at risk and spreading within the facility. The employees in this situation include some of the nurses and physicians coming in contact with various elders and patients on a daily basis. They all must be made aware of the new protocols to prevent risk of spreading the virus if any cases are to come up if the pandemic worsens in the outside environment. Their performance standards are not only being looked upon to allow them to stand out as an employee, but to enable everyone to work as a team in the exact same ways to provide quality of care to patients and adapt to a current health issue that puts our population of patients at a high risk. Hello, fellow nurses and physicians. Thank you for being here today to discuss this matter. I will not be keeping you too long, but I would like to go through our new protocols to take action to the new and unexpected outbreak of COVID-19 throughout the U.S. As you all know, this clearly has a direct impact on our patients, and we must do everything we can to show them that we are taking all possible precautions.
When will they be put into effect? For how long?
Well, the changes are minor and not difficult to follow. Unfortunately, they are being put into place as soon as possible and until further notice, depending on national standards. However, there are many little changes that are going to be made. It is crucial that everyone following these guidelines it is important that we enforce them at all times due to the level of severity of the outbreak and how our population is at risk. Unfortunately, anyone who is unable to follow these new requirements will be sent home immediately. I do not want to sound harsh, but this is for the best regarding our patients and our business in general. Therefore, I'm going to list all of the new standards for now. I ask for your full attention, and I am more than happy to answer any questions.
We are happy to do whatever is expected to us.
Thank you. I am now going to go through a list of standards that are crucial that we start immediately and follow at all times. Some of the resources needed include latex gloves, masks, extra hand sanitizer dispensers in each department and outside each room, paper and disposable covers for everything in each patient room and throughout the entire organization. Necessary skills include hand washing before and after contact with every patient, as well as limiting contact. Providers must also clean up all equipment used, especially those that come in direct contact with patients. We will also be allowing no visitors for the next 2 weeks, and we will then make a decision whether we should extend this procedure depending on national standards. Anyone who walks into the facility will be required to answer a questionnaire regarding possible flu symptoms or recent travel out of the country. Even small tools such as pens, buttons on printers, keyboards on computers, etc. are to be wiped down with Clorox wipes after use. If any patient is to be tested positive of COVID-19, they will be quarantined within the facility or transported to the hospital depending on what would be best for the patient as well as others. We will work extra hard as an organization to make sure there is minimal to no spread of germs whatsoever throughout the entire building. Employees are also to sign a waiver that when off duty they are limiting their contact with others and possible spread of germs while not in the facility. We want to reduce the risk of providers contracting the infection and then bringing the risk to others to work within the next few weeks and in the future in general. Are there any questions regarding any of the statements I just made?
Should we be using gloves at all times?
Yes, if need be. You must wash your hands or use a hand sanitizer dispenser before and after taking gloves off. This should take place at all times. Any equipment you touch without gloves, such as pens or computers, will be wiped down with Clorox wipes before anyone else uses them. And you must disinfect your hands before and after using. Utilize a new pair of gloves. Does that help?
Yes.
Great. Any other concerns?
Just to be clear, there are no outside visitors. What about vendors?
No visitors at all until further notice. Any other people entering must answer our questionnaire and then continue the work they must do while also following our protocols of washing hands and minimal spread of germs. I will try to monitor people who come in and out as much as possible. If anyone is to answer yes to any of the questions in the questionnaire, unfortunately I will have to escort them immediately.
Can you go further into detail of how we should prevent contraction and spread of the virus while off duty?
I would like everyone to try to only be in public places when absolutely necessary for the next 2 weeks. Try to keep 6 feet of distance between yourself and others at all times. And while you are at home with your families, try to use similar protocols to what I mentioned for your shifts here as well. Keep cleanliness in mind. I can't stress enough. If you are not feeling well in any way or feel as though you have some kind of infection or germs that you might be bringing into work with you, please do not come into work. We need to keep our patients in mind as they are our top priority. Spreading infections throughout the facility will only make matters worse for them as well as our staff. Does all of this make sense? Do I need to go over any more concerns? Okay, well, we need to get the ball rolling with our new guidelines as soon as possible, so please start practicing these strategies. If any questions come up at all, do not be afraid to ask. Everyone is expected of the same thing, so I would like to see consistency among all of you going forward. I wish I could have a better time frame for this, but fortunately, these are good habits to get into anyway. I appreciate all of your cooperation and understanding. Thank you again. Stay safe, everyone.
Terrence is a new child life specialist at Newark Beth Israel. This position requires Terrence to go into patients' rooms and ask if they need anything. Each kid is allowed 2 board games, 2 deck of cards, or 1 of each. It's important to ration out the games because most donations come once a year. Kate will be speaking to Terrence about his interaction with patients and what could be done better. The meeting will be taking place at Terrence's 1-month performance meeting. Hi Terrence, are you ready for your 1-month performance meeting?
Hi Kate, yes I am.
Great, let's start. I just want to start by saying that you've been great here and you've been very helpful to our whole operation.
Thank you so much. I'm enjoying it so far.
Even though you're doing a great job, there are some areas that could use some improvement. Those two areas are giving patients 2 board games, 2 deck of cards, or 1 of each. The second area is making sure you get to patients with a bag of activities within an hour of them getting to the floor.
Well, I'm sorry. I've been trying hard to say no to patients, and I know we only give 2 board games, a deck of cards, or 1 of each to patients. But when they ask for another one, it's hard to say no because they get upset. Also, with providing an activity bag to patients within an hour of getting on the floor can be tough. I thought I'd been doing a pretty good job of getting to them within the hour.
That's okay. I understand it can be tough saying no to patients. It's important that we have enough activities for every kid so they all have something to do. How do you think you can improve this?
Well, I guess I can try to explain to the patients why they can't have another. For example, if I'm sorry, but I can't give you a second board game because you already have one, and a deck of cards as well. We must save some of the other games for the other children too, so I can't give you a second one. Is there maybe something else you might want?
That's perfect. You told the patient why you couldn't, and you asked if they want something else instead. Just remember, if you do supply them with something else, it needs to be something we're able to disinfect after the child leaves. Now for the second issue of not getting to kids in an hour of them getting to the floor. What can you do about that?
Well, I guess when children come onto the floor, I should be more mindful. When I first get in, I should also look at who's being admitted, so I'm prepared for the day.
Both those solutions work. You can ask a volunteer when they come in if you know you won't have time. The volunteers here are here to help, and they can also play with the kids if you don't have time.
Okay. I'll make sure I'm more mindful of it and remember to tell a volunteer if I know I won't have time.
Thank you so much, Terrence. Once again, thank you for everything you've been doing this past month. I hope you enjoy working here and you'll stay a long time. We appreciate everything you've been doing.
Of course. I've been enjoying my time here and I look forward to more years.
Caroline owns her own dental practice, which has recently shut down due to COVID-19. Prior to the office closing, there were issues that arose between two dental assistants. Alicia and Ryan share 40 hours a week between the two of them. Ryan voluntarily cut down his hours due to personal reasons, and he was not eligible for intermittent FMLA leave. Ryan would like to resume working 20 hours a week, and Alicia would like to switch back to 20 hours a week so their hours are equal. They are both good workers who have worked at the office for around a decade, and they are nearing retirement, so they both prefer the 20 hours a week schedule. Ryan is frustrated that he is still only getting 10 hours a week and feels that Caroline is playing favorites. Caroline would like to address this concern during their time off to ensure there will be no confusion going into scheduling once the office reopens. Caroline has set up a Zoom conference call with Alicia and Ryan to discuss the scheduling conflicts. Hi, Alicia and Ryan. I know that there have been some questions regarding the schedule, and I wanted to discuss this with both of you.
Yes, I've been working 10 hours a week for 3 months now. When I needed to cut down, I only needed this change for a month, and it is unfair that I'm getting shorter hours.
A few months back when we switched the schedule, I knew it was temporary, but I did not know the timeline. I was willing to cover for you as much as needed and did not want to push you into going back to your normal schedule until you were ready.
It was also my understanding that you would both tell me when the schedule needed to be adjusted again.
You didn't bother to check in? I told you, when I needed to cut back in the first place, it would only be a month.
I do apologize, but we are seeing a drastic increase in patients due to the anticipated closure. I apologize for not checking in sooner, but this is an unprecedented busy time for us.
I meant to too, because working 30 hours a week is difficult for me physically. The 20 hours a week for me is preferred, but I did not want to pry because I did not feel it was my place.
From my perspective, it just seemed like you were picking favorites with Alicia.
Ryan, you are an exceptional employee and have been an asset to our office for nearly a decade. I apologize for not checking in sooner, but please know we value all of your hard work and did not intentionally short you hours. I do not recall getting any formal confirmation that you would go back to your regular schedule, and I would have done the next schedule accordingly.
I guess I probably should have mentioned it again, but I also felt like I shouldn't have had to.
I know you were going through some difficult times, and I think we should all take some responsibility in this.
That makes sense. It could have been handled better from all angles, and I acknowledge that I should have been more vocal too.
I am sorry for not checking in sooner too. I have not published the newest set of schedules yet, and I'm going to make sure that I change both of you back to 20 hours a week once we reopen.
That sounds great. Also, you could have extra hours the first few schedules. This way you can get back to your regular schedule even sooner.
I will hold off on those first few weeks, but I appreciate it.
I think going forward, we will need to track these changes too. Maybe we can have some sort of form you submit online through our scheduling system to track any schedule changes. This way, it will be easier to keep track of it, and it will be in the system, and we can easily make changes if necessary.
I think that addition will be helpful. Going forward, I'll make sure I'm more on top of my communicating my schedule.
I will also make sure to check in on you.
I will make sure we implement this new form. Would we like to revisit this in a few months once we reopen?
Yes, that sounds good.
Yep, works for me.
Thank you for taking the time to meet with me today. I once again apologize for any miscommunication and hope we can take this opportunity to grow and improve our processes.
One go.
Mark is the social media coordinator in the marketing department of the company North Face, and in his short time working for the company, his work has not come close to the expectations that were set out for him. He was told that as a part of his job, he was required to manage the social media pages for the company and post up to 5 times a week promoting the company to our followers and customers. He's been with the company for over a year, and although when he first started his work was very good, over the past month and a half his performance has been on a steady decline, to the extent that he's only posting our pages once a week. As a result of his poor work, I believe that it is necessary as the manager to sit down with Mark and manage his corrective actions. Good afternoon, Mark. Would you be able to meet in my office for a few minutes so we could speak?
Of course, I'll be right in.
Hi, Mark. How are you doing today?
I'm doing great. How about you?
I'm doing good, thank you for asking. The reason I wanted to speak with you today is to address a problem that I've noticed within the past month or two that I believe has been having a negative impact on other employees in the company. When you joined this company over a year ago, we laid out various different expectations that were expected from you. Do you remember this?
Yes. I remember that when I first joined the North Face family, the work that I was expected to complete was laid out for me, and I recognized the workload and expectations and embraced the job that was given to me.
Great, that is correct. Do you remember what our expectations were of you as the social media coordinator in terms of our social media pages and the content and number of posts we agreed upon?
Yes, if I recall correctly, I think we agreed that I should be posting about 5 times a week on our social media platforms and updating the content to keep it fresh and appealing to our followers and customers.
That is correct. The reason I wanted to meet with you is to address the gap between the agreed on expectations and your present performance work that you're putting out today. As we just went over, when you joined the company, we made it clear that you were expected to post at least 5 times a week on our various different social media pages. And over the past few months, there's been a steady decline in your work, sometimes even as severe as only posting once or twice a week. This is a big gap between the expectations in which we agreed upon and your present performance. Would you agree?
Yeah, I would agree with that statement. I haven't been living up to the expectations that the company has for me over the past few months.
That is correct. The work you have been putting forward not only isn't enough, but it has had a negative impact on the employees working around you and on the company as a whole. As a company, everyone is expected to work as a team, and when one person isn't carrying their share of the work that the team must complete, it results in having a negative impact on the people around them. Being the social media coordinator of North Face, you hold a lot of responsibility in marketing our products and keeping this company on top of the food chain when it comes to clothing. With that said, your performance has had an impact on the company in various different ways, and I would like to hear your view on the situation and any ideas you have to correct the problem.
I understand that the impact that I have had on the company and other employees, and I would like to apologize for my poor performance in the workplace over these past few weeks. I don't have an explanation for my poor work other than it has to be better. When I accepted this job last year, I embraced the role and expectations that were given to me, and I'm aware that my present performance isn't where it needs to be. In terms of ideas to correct this problem, I think I need to motivate myself in different ways so that my work can become better. And I also believe better time management can play a big role to get me back on track. For example, I think it would help for me to set specific deadlines 5 times a week for when I need to post and update our pages, and that will help me stay on track with all my work.
I agree and believe that if that is something you believe will benefit your work, then I think it is a great plan to put in place. As your manager, I'll be keeping track of your work on our pages over the next couple of weeks to make sure that you're staying up to date with work and getting back on track to what is expected from you. This is a problem that must be fixed as you play such an important role to the company, and what is expected from you is what we need to produce on a weekly basis.
Okay, I understand and want to make sure that my work becomes better and closer to what is expected to be. This job means a lot to me, and I want to make sure that everyone here is as happy with my work as I am.
I'm glad to hear that. So moving forward, I want you to take the corrective steps that you believe that you need to take to become better, and I'll be keeping track of your work and making sure that you're staying up to date. I think it is important for us to meet again to follow up on this discussion, say in around a month.
Okay, that sounds good to me.
Good. Your position here is incredibly important, and I don't want to see this problem go any further, or any further action have to be taken to solve it. Do you understand?
Yes, of course.
I have human resources here with us to limit any misunderstanding.
Okay, sure.
Our expectations here at Beautiful Venue were made clear upon your hiring, that timeliness to run events and our presentation, especially our uniforms, are of primary importance to this company. As we review your last few shifts here, you had signed a written warning that you obtained for being late and not in proper uniform. Do you recall this warning that I have here?
Yeah, sure, whatever. It was stupid because my car tire was flat.
This was not the first time you were over 30 minutes late without a phone call. And your uniform was missing a tie as well, correct?
Yes, but who cares? When I'm here, I do a good job, better than any other staff.
Javier, we laid out the guidelines that all employees must follow, and you have failed in reporting to work on time and wearing the correct uniform. We had given you an opportunity to change your behavior since your written warning. We will need to end our employment here. You will be paid for the rest of your shift today, and you will have 30 days to clean and return your vest and ties for your deposit refund. Do you understand, and do you have any questions?
No, this job was stupid anyways. I need to get my keys from upstairs.
Not a problem, Javier. Colin from HR will walk you upstairs to obtain your keys and guide you to the exit building. Goodbye.